By saying, when I received the information about this gathering, it said an expert panel. I'm not an expert, but I do work with the experts. I work with the people who are out in the field, all kinds of people serving our youngest children and families. And whenever an opportunity such as this comes forward, I always go to them to hear gather their input, hear their comments that so often, especially in greater Minnesota, aren't heard unless there's some avenue such as this to share their thoughts and how things have an impact in their communities and the work they're doing. We have been very privileged. The Northland Foundation received one of the 6 FFN grants. And at the time when we decided to apply for this, as many of you know, we are part of the Minnesota Early Childhood Initiative, which was launched by the 6 Minnesota Initiative Foundations in 2003. And we offered to some of our coordinators in the Early Childhood Initiative in our region to come together to talk about would they be interested in participating in an effort around FFN. And I've told this story to others that it just happened. It was at the end of a day-long meeting in St. Cloud. And the 4 communities, 4 school districts gathered at 10 o'clock at night. I would have said it was 10 in the morning because the energy was so great. They were so aware of their families, knowing who their families are, and that many of them were accessing FFN care. In many instances, it was grandparents. So their enthusiasm was great to put their heads together and help us design a proposal that would really use the dollars wisely and have the greatest impact out in their communities. I'll just share just a little bit of information about the strategies that kind of evolved from this grant. We were thrilled also that it was continued. Initially, it was a 2-year grant, and then through the ERA funds, able to continue 2 more years. So that groundwork that was laid, the learnings, the lessons learned could be built upon, and true long-term connections could be made in relationships. But initially, the 4 areas are Carleton County, Lake Superior School District, the Duluth Schools, and Proctor and Hermantown. They did some research. They actually went out and conducted surveys and focus groups asking people, FFNs, or connecting with them, how can we really have an impact and help you with your work? And the 2 strategies that emerged were the home visiting strategies and then play and learn events, which actually is a borrowed term from, I believe it's out in Oregon, where there's been some work around FFNs. These 2 strategies have been very effective in bringing people together, helping people to feel less isolated, and actually going out to people who oftentimes cannot leave their home for one reason or another or have transportation issues. The FFN outreach people have been very well received. I'll just add one more thing, and that is that the ECFE programs are the ones who have served as the home visiting staff and have actually provided the play and learn events in the region. That doesn't mean that they are isolated from Head Start, though. They tap into the Head Start programs, parents, to find out who are the FFNs, seeking as many connections as possible, because that's the biggest challenge. How do you find people? And so they kind of work every avenue possible, talking with parents, talking with the Head Start programs and other ECFE program-related people. But these strategies have been effective and have been able to reach many, many FFN providers. And one little last thing, and I know then I need to turn it over to someone else, but a big part of the success of this effort is that these home visitors and the program coordinators come together on a regular basis. We just met with them last week, and they said, you know, if we were doing this alone, the impact would be far less. They share ideas, they build upon each other's ideas, they share training opportunities by having different speakers come or trainers come around travel around the region, and that has worked well in helping to really build the knowledge and reach for the FFN community.
Lynn, would you say that through the home visits, they're finding stressed out, sort of chaotic environments, or is it mostly?
Very much so. You are talking very, very low income families, grandparents. In certain situations, the home visitors are amazing people. And they will talk about that they really listen and learn from the family what it is they need. And there have been situations where the home visitor will decide to do nutritious eating, going into the home and helping them create nutritious snacks, bringing food with her because food is so limited and such a concern in that family. Mm-hmm. And it's been amazing who has come forward. In fact, I'll just share one story in Duluth. The home visitor had a number of people register for a play and learn event, and she said a lot of those people didn't come, but a real diverse community of people came. And she said they truly were very, very low income and people that needed support and help in what they were doing for caring for young children.
Mm-hmm.
As I was listening to the information and reading through some of it last night, it dawned on me, as probably many of you in the room realized that, oh, this sounds familiar to me. I used my mom to care for my last child. I have these children spread across 3 decades, which my oldest sister loves to remind me of. But that last one, I used my mom. I hired my mom to provide childcare for him. And then I was fortunate enough that I could offer her some income. So it worked. It worked for us. And then she was there for my other children when they came home from school. So it was a win-win for us all the way around. And one day I came home and my oldest sister was sitting there waiting for me when I got there. And she said, Sharon, this is just unfair to Mom. Jahi went up, that's the youngest one, when he was upstairs in the bathroom and he pushed everything that was on the top of the toilet into the toilet and then he flushed it. And then Mom had to go up there and clean that up. Well, by this time he was about 3.5. You've got to get him in some kind of preschool. This is just not fair. So my mom was kind of reaching the end of, managing this little 3-year-old, and he was getting away from her and doing things to elevate everybody's attention, do something, I'm getting bored. And so then I put him in childcare part-time. I couldn't let go of her that quickly. I was holding on for dear life. The thing so I just want to tell you guys that story. I kind of remind myself of it periodically. And then I was using FFN Care as well for my family. And it really was a blessing for me. And what I think what the families are telling us is that this part of it is poverty. I have to reach out for help and support in any way that I can. And that's not the worst thing in the world. That's actually can be a good thing. Mm-hmm. It keeps families connected around the needs of children. I think when we first started looking at FFN Care, we almost romanticized it as it just being this wonderful, wonderful thing for children and all that. And it seems to me that the field is now recognizing that we need to be more realistic, as you were saying earlier, Richard. But it is a way for us to continue to help communities build capacity to care for their own, mm-hmm. which I think that's what's going to lead us to kindergarten readiness. That children from birth through 5 are in communities, whether it's inside the home, the geographic community, wherever it is, where the adults around them are fully prepared and understand how to care for the developmental needs of very young children. FFN Care provides an opportunity for us to continue to build capacity in communities, but to not romanticize it, because many of these families are in deep poverty. Yeah. They're struggling with managing to meet their needs day to day. So creating that balance between those two. I wonder sometimes, though, is what we're learning about the prevalence of FFN care going to get us to start to think differently about child care assistance? Is it going to push us to think differently about what is the real value of child care assistance? Is it simply to get an adult to work, or is it to nurture the health, well-being, and development of children?
Gee, it's fun to follow other people. I'm rethinking everything. No, I'm not. What I am and generally drawn to wanting to answer about here is thinking systemically, because that's what we do. And one of the biggest, I think, first of all, to call it family, friend, and neighbor does it a bit of a disservice, because each of those are distinct parts, and under those are many distinct parts, and we have this tendency to lump it together as if it's one creature, and it's not. So one of the things that I think is important to do is sort of to unpack that and think about who those various audiences are, and then who are the best messengers for those audiences. What Lynn talked about, I think, really illustrates the opportunity we have, which is this is one of those areas where really some of the disparate groups that sometimes feel disparate around early childhood really have a place to come together. There's a lot of crossover. When you think about, as I mentioned, those different audiences, for instance, our national office, NACRA, has a tendency to separate out the family from the friends and neighbors and really zero in on who are those folks that are doing this for pay, that maybe don't even have kids under 12 anymore. That's looking more like a business. Maybe they need a different level of support and messenger and supporter than grandma, obviously. And so I think thinking about who those audiences are underneath that big umbrella is one step. I do think that some of the coalitions have been much more successful than any of us can be on our own. As you probably know, or if you don't, Child Care Resource and Referral has a strong commitment to the entire waterfront of child care, and we include family, friend, and neighbor in that. It's wherever the child is when they're not with their parent, basically. We want to make sure that those caregivers are supported, have access to information, have access to training if appropriate. So we try to look at the whole waterfront. And so a sliver of what we do with grants, with training, with supports, always focus on that population. But we can't even go inch deep, really, when you think about the huge numbers out there. So we've chosen to target, in many cases, either new immigrant communities and refugee communities where this is a strong source of care, or, as I mentioned, maybe some of the caregivers who are receiving subsidy, who are doing this more for business, if we can find them, and of course that's a whole other issue. I do think I wrote to my 3 points for myself that I'll just use. One is to think about how do we connect some of the information that we've been developing as part of the quality rating improvement system to that population that aligns with that information but is appropriate for that audience. So some of the things that we've been doing with providers, we started with a building quality checklist. Are there things that can be developed that are, and I know that they have been, but more, perhaps universally, that gets out into the hands of family, friend, and neighbor providers that's aligned with where we're headed, but obviously doesn't have things like observation and some of those aspects that may not be appropriate. What can we do to incentivize family, friend, and neighbor providers to participate in any of this, I think is still a big question. We do a lot of play and learns and try to use those kinds of incentives that we've all talked about over the years, gift cards and that kind of thing, to get people to come to things. But what do we need systemically for incentives? And then I really think increasingly working with the organizations that already have the trust of those parents, in particular grandparents, relatives, the people that are doing this care, really having them help us be the messengers about early childhood and the importance of child development. I'm thinking particularly a lot of the cultural intermediary groups that already have the trust. Instead of trying to go into a community as early childhood practitioners separately, working with those organizations and really trying to make sure everybody has the information about good early childhood development. I just want to say, too, to echo a point that was in the report and that you brought up, also working to make sure that this is a true choice. And I'm always careful because we never want to criticize or even assume that all families aren't intentionally and fully choosing family, friend, and neighbor. But I think the graph that you put up about what happens once people have subsidy, is it, and I say this about all settings, are people really able to make a true choice? And I think that's another important factor that plays in particularly to family, friend, and neighbor.